Okay, noting that it is 7:02 p.m. on January 5th, 2022, I'd like to call the Board of Health meeting to order. And because it's a virtual meeting, we need a roll call, not really a vote, a roll call to indicate which of the board members are here. So this is Daryl Beardsley, present.
Rebecca Honeywell, present.
Matt Vitale, present.
Okay, so we have two variance hearings this evening and a number of items on the agenda. And sorry, I just keep getting distracted by admitting people. There have been some updates to the agenda, as you can see, but I'd like to go over some items to potentially add to the agenda as they were not reasonably anticipated by the chair 48 hours in advance of the meeting, and then we can vote whether to amend the agenda. We have a building application for 59 North Main Street. There are, let's see, a disposal works installer permit, discussion about meeting with advisory committee. All of these, we do have COVID-19 on every meeting agenda that we have, but there's just some additional specifics. One is reconsideration of precautionary measures in response to current conditions, clarification regarding the CDC mask mandate in preschool, and issues about at-home test kits. Are there any other items to add to the agenda?
That does it for me.
Okay. And Mark, I believe you said that you received a phone call just
Yeah, Daryl, and
literally
I just
a couple of minutes
a
ago.
couple of minutes ago, and we just received an email at 7:03 this evening from our building commissioner asking if we could discuss 74 Washington Street. It's kind of last minute. I just was trying to quickly read it as I was sending it off to you and Ellen. But it's one of those issues that they're looking to do a little bit more work prior to finalizing septic and well requirements. It's up to you if you wish to put it on the agenda, but it's very last minute.
Yeah,
My 2 cents is if you received it at 7:03, I think it's too late for a 7 o'clock agenda.
Okay, and I'll let them know. We meet in 2 weeks, so that seems reasonable to me.
Daryl,
Okay.
did that pass the sniff test?
yes, at best, I would have said we could hear some of the issues, but I just can't imagine having any of the backup information that we need.
Yeah.
And that we have a chance to digest appropriately. So,
And I'll let them know. And they were given very distinctive and a very good overview of what needs to be done today. So unfortunately, until that's done, they need to, adhere to that. And that goes back 9 years. So they know, the new applicants don't realize it, but it's something that needs to be resolved, and it's overdue.
okay. All right. So do we have a motion to amend the agenda with those 6 items noted?
So moved.
And
Second, I have one more thing that I just want to comment on. I'm not sure this needs to be an agenda item,
Sure.
but at the last meeting, you asked me to follow up with the procedure that the town of Falmouth follows for public health announcements and information for the community. And I do have a copy of one of their announcements, but I wasn't able to get it to Ellen 48 hours before the meeting. So maybe we could add that to the agenda for the next meeting, and I can give it to you and everybody to review.
yeah,
sounds
I think that
perfect.
would probably be better so that we could, because we do have a lot of challenging topics this evening. So that would be perfect. If you could do that, we'll have it on. So we already have one of our things for later, items for the next agenda. Okay, so, all right, any other?
I just thought it might make sense to open up with the COVID topics unless you object.
That would be fine. First, we need to vote to amend the agenda. So if there's no further discussion, then Daryl, aye.
Rebecca, I.
Matt Vitale, aye.
Okay, and COVID.
So Daryl, if it's okay, I'd love to share my screen.
Yeah.
All right.
All set?
Perfect. Do you guys see it right now?
Yep.
So again, this is data that's regularly circulated to the board. For context, for folks for whom this data may be new, this is data that's released weekly by the state. The timing of it is such that the data from December 30th reflects a data period that ended December 25th. So that lag when things are relatively stable is trivial, but where things are very dynamic as they are now, it will lead to a little bit of an underestimate typically of where we are. So this first slide is just the average daily rate per 100,000. The red line represents the combined metrics for Dover and Sherburne treated as a single community. And so what we see there is that both locally and across other like communities in the region, we see continued accelerating case rates that are substantially higher than anything else we've had since the end of the last school year. If we look at the next slide, this is the testing per capita. So this is the total number of tests over the last 2 weeks divided by the total number of residents. So some of this may be multiple tests with the same individual, but again, it gives you a sense of comparative testing. So continue to have a lot of testing around the Christmas holiday period, which I think is similarly observed for the state. Again, pretty similar to like surrounding communities with Wellesley having very high testing and partly, I think, related to their patterns of education-based testing. Unfortunately, our percent positivity across the region has continued to rise substantially. And I think anecdotally, folks have probably heard from a lot of people who have sought PCR testing and have not been able to access it. So this percent positivity sort of fits with that. And I suspect we'll see much, much higher rates in the next data set as the case rates accelerate. I think one part that's limited with the percent positivity is this is limited to the state reported PCR tests. So individuals who test with a rapid antigen test at home who do not seek a confirmatory PCR wouldn't appear in this set. So this is likely an underestimate of positivity across domains. And then this is the combined case count between Dover and Sherburne since May of last year. And we see that kind of accelerating phase over the month of December, where we went from 575 cases on the December 2nd data report to 713 cases on the December 30th. This slide is a breakout of Dover versus Sherburne as compared to the state. Again, I think that, when we get the data for this week, we'll see that, the state is well over 100 per 100,000 per day. And that we'll certainly see Dover and Sherburne similarly rise. I think one of the pieces that's helpful is that at our peak of last winter, as we sort of look at the January 7th and 14th range, when we peaked locally and when the state peaked as well, we're not markedly higher than that for that data point. I think what we'll find is that as we see the effect of both the holidays and the Omicron surge, we're likely to peak dramatically higher than that locally, and certainly at the state level, the existing data suggests supports that as well. This is the state reported data for the patterns of vaccination locally. Again, for folks for whom this data is not familiar, the numerator for this is individual reported data as tracked in the state database, and the denominator is an actuarial calculation based on historical census data. I think what we've seen is across age groups, there's been robust vaccine uptake. I think what we know now with Omicron, which I'll talk about a little bit in a moment, is that really it's this last column that will become increasingly pertinent. What we know for Omicron is that the effectiveness of vaccine at 2 doses for the mRNA vaccines is significantly lower than was the case with Delta. There's still reasonable protection against hospitalization and death, but from a case protection standpoint, and the need for isolation for those individuals, that remains a substantial issue. And so we sort of go from a place where with Delta, we were very well vaccinated with an effective vaccine to, for Omicron, we're essentially, 46% of the population has vaccine status that's probably about 70% effective, as compared to previously having about 95% of the population with a vaccine effectiveness that was more like 80% effective. On top of that, we know that Omicron's transmissibility is significantly more transmissible than Delta was. I think the encouraging news is that the rate of hospitalization and death appears to be significantly lower than Omicron, or for Omicron than Delta. And I don't know if you guys can hear my kids crashing around downstairs, but it may be better than the living room right now too. This is the data that comes from the wastewater treatment data. I think this is in many ways some of the most worrisome data. What this looks like is the viral burden in wastewater effluent. And I think what just gives me so much pause is the degree to which the scale has changed over time, where our peak of last winter is a tiny fraction of the viral load that we're seeing right now. That doesn't necessarily mean that this is the same number of cases driving it. You could have the same result if you had more shedding in stool, for example. But I think that when we look at it with the case data, it tells us we're in a much different position than we've been at any other point in the pandemic. This data is extracted from the New York Times. The link's at the bottom. This is the data from today, which again shows a substantial increase in cases that began in mid-November and has accelerated more recently. We have a more modest uptick in hospitalizations. We've got relatively static total testing volume compared to the year before. And thankfully, the death data has been substantially more blunted than what we saw last winter. Some of that may be related to the intrinsic lag about how long it takes from the time you get sick with COVID to hospitalized with COVID to passing away from COVID. That one didn't come through. It's unfortunate. And then the last one apparently didn't come through, which is just a visualization that's also from the New York Times that illustrates what's described as essentially a decoupling of the case counts and hospitalizations, where across the Northeast, we have many areas that are kind of three, 4, or 5-fold what they were at last winter's peak, but are still below the peak hospitalizations. And again, our kind of working theory right now is that that's because Omicron is somewhat less likely to cause high morbidity outcomes like hospitalization and death. Although I think the data is still a little bit early to really conclude that. So with that, I'll sort of stop sharing my screen. I think it just sort of gives pause as we think about what the next phase looks like. So maybe let me pause there for questions either from the board or from the community about the data piece, and then we can talk about the advice we give to the preschools and some of the other topics as it relates to COVID to the degree we're able to before the variance hearings.
Okay, so one thing I would note is what we're hearing a lot about are people who are doing at-home testing and testing positive, but are not either not choosing to or are not able to get PCR tests. So I guess when I look at this data, I'm automatically ratcheting it up from the reported data. And I think that's a different phenomenon than we've had in the past, when the tests were not as widely available as they are now, although they're tough to get at the moment.
No, I would echo that. I think the state level positivity rate, even compared to a week ago, is dramatically higher. And the testing delays are substantial. So I think that this is a low estimate compared to the total disease burden. And I think for kind of what we can expect based on the experience out of South Africa is, a very rapid rise. Our hope is for a relatively narrow peak and a relatively rapid fall, but I'll sort of believe it when I see it. And then the other update that the CDC had provided, which I think is somewhat pragmatic, is to allow people to return from isolation after 5 days with the requirement that they remain masked when around others for an additional 5 days. And that is also predicated on being asymptomatic. So maybe with that, I can kind of transition to agenda item number 5 in the added agenda, which is that our public health nurse had reached out to me for guidance about how to most appropriately apply the revised CDC recommendations, which would allow return after 5 days with masking to a preschool population, which is often unmasked. Sorry, Jeff, I missed your hand. Feel free to fire away and then I'll get into preschool.
Well, it's just a question. I think I know the answer, but maybe
Sure.
clarify for the at-home audience. If people, are we giving guidance if people have tested positive with a home antigen test? Are we giving guidance to them on reporting the result or sharing the result, particularly given that they may not be able to secure a PCR test in a timely fashion?
I mean, I think that people certainly can report it. I'm not aware of any mechanism for us to actually put it anywhere in terms of reporting it back to the state or sort of having that then translate into sort of systemic data. And I think that the experience across many sites is the ability to complete contact tracing is being rapidly outpaced. We had the substantial state supports that then were shut down at the end of November. And so I think that, you know, there's just, even the cases that are already identified, there are inadequate resources to contact trace everywhere. And so the guidance from the state has been to focus on particular areas like nursing homes, schools, and other kind of high density populations. And so as it relates to preschool, the question was, given that many of the preschool age children are not able to mask and thus not able to comply with the CDC requirements, which isn't, I mean, the CDC has really said it's, you can come out of quarantine, you can come out of isolation at 5 days, not, and then be masked. It's not come out of isolation and then mask if you'd like to. And so the guidance I gave to the public health nurse is that for those preschoolers who could comply with the CDC requirement for sustained masking, then it certainly would be consistent with that to allow return on day 6. For preschoolers who would not be able to comply with masking, then I think that my interpretation of the CDC guidance is that they would then need to remain in isolation until after the passage of day 10. So that was the guidance I gave to Alyssa. I didn't think it required a motion or vote of the board, and I characterize it as guidance as opposed to a sort of separate Board of Health requirement. I think this is all coming from the state and from the CDC, but just wanted to update folks and see if there's any comment or any other take on it.
Sounds reasonable to me. Rebecca, any comments? And, okay, are there any questions from people about the preschool situation in particular? Okay, otherwise I'll move on to some of the other things, including a little bit more on what Jeff was asking about people reporting. So I have the issue here, reconsideration of precautionary measures in response to current conditions, because as we said, we would, at every meeting, we do revisit where we stand. And I think that conditions are such that I would really like to see our mask mandate for town buildings return. I would like to see no in-person meetings and focus on remote meetings for the time being, and we will revisit this again at our next meeting in case things change significantly.
And Daryl, I would really just echo that. You know, I think in our last meeting, what we discussed was for town buildings and municipal buildings, the degree to which that's protective of the community is probably limited, since folks are active in many other social environments that may not have the requirement. I think as we now enter a phase where, you know, the case rates are probably 5 to 10-fold what they were at the time that we had that discussion, I do think there's a piece about it, you know, what gives us the best chance to preserve town functions and what does the best job kind of reducing the risk of staff becoming infected, particularly those who have not yet had a chance to be boosted. I think that the rationale for doing it is not to say, you know, this is going to really change the likelihood of a given Sherburne resident acquiring COVID at town hall. I think it's really to say, boy, I really don't want to see an entire department with everybody out with COVID. And I think with the current kind of rates that we have and the transmissibility we see, I'm worried that's a possibility without a kind of masking strategy. It's just, it's behaving really differently than Delta did. And we're seeing
Yes.
that at the hospital where we're just substantially impacted on staffing like we've never been before. In my own group, we've had more people go out in the last week with COVID than the preceding 18 months. And that's with lots of strategies to mitigate the risk. And I think we just need to be really as proactive as we're able to while continuing to have society function. But I think also having robust strategies to allow remote work, we're going to have people who are out, and I think that we're going to have people who are at risk. And so, you know, if this ever made sense, I think it certainly makes sense now.
Yes, and right, I agree with you that in terms of overall town dynamics regarding COVID, that this is not the be all and end all solution, but the town is an employer and we do have employees. And so in the interest of protecting the folks who keep the town running. And also the other thing you hit on, exactly what I want to talk about, is that we never recommended any kind of rollback of the work from home strategy. And I would like to make it clear that our recommendation would be, depending on how we vote on it, would be that work from home be done to the extent possible. And that the town administrator would support that. So are there, just on those particular issues, masks, in-person meetings, and work from home strategies, are there people who have any particular comments or questions about that?
Daryl, this is Wendy Alassi, Director of Assessing. Are you looking for comments from the board, or are you looking for
A community
employee or
comment fine,
public?
maybe. Yeah, public's fine.
Oh, it is, okay. So I had a question. So there's been some cases at Town Hall, and we had only been we're never notified.
So Wendy,
Right.
your connection,
After, there's in a meeting.
okay.
Oh, I'm sorry. Can you hear me? Is that better?
Yes, now it's better, yes.
Oh, okay. I apologize. So there's been a few circumstances where there have been COVID cases over the past couple of weeks, and no one's been notified. It's just kind of like hearsay after like a week. And so I don't know if I know that there's a few of us who would like to see some sort of, protocol in place that, you may have been in contact or close contact. And I don't know how that could be implemented. And I think I've been pretty forward about my medical issues that make me extremely compromised. So I've been wearing a KN95 and doing kind of a hybrid. But
Okay,
there's
so
something we could put in place.
So I think I don't disagree with you with any of that. I think part of that is probably in the purview of the town administrator as opposed to the Board of Health, because it's sort of related to the personnel and operations.
Correct, yeah.
Yep. So I would say I'm certainly supportive of saying I think there should be a strategy there. And I think to Daryl's earlier point, I think having robust and resilient strategies to account for the fact that I think we will need to have people who are either out, whether it's because of personal health factors or actual infection. And so I think being prepared to do that in a way that also maintains access to town hall to the degree possible, so that we kind of stagger when people are in. I'd much rather sort of have one person in all the days a week, then 2 people and then they both get COVID, then nobody's in that office and the public doesn't have access to those services. And so
Exactly.
I think having good strategies around that are certainly something as a board I would strongly endorse. And I think as a healthcare worker in this space who spends a lot of time dealing with this, like this is going to be an issue we need to deal with. I don't think it's going to be a 6-month issue. I think this is going to be a period that is exceptionally challenging for the next 4 to 6 weeks, and extremely disruptive in that time period. My hope is that we'll then sort of, again, I don't want to use a brush fire analogy with Zach, because I think I'm probably speaking out of my expertise, but I'm sort of picturing it as I think it's going to be really challenging, but not forever.
Right.
So this ties into something that Jeff brought up too about, and that Wendy, you mentioned about notifying people. And again, the dynamic is different this time because we were learning about cases in the past more from observed tests that then get reported into the state system, and then the contact tracers and the public health nurses would get involved and find out who were close contacts and reach out to all those people. Now with people being able to test on their own, identify whether they're positive, it starts to fall onto other recommendations in the past where it was people were asked to then notify the people they knew that they were in close contact with. And the question becomes, do we as a town want to, make a formal either request or put out some formal guidance that if you do a home test and you test positive and you don't have a chance to confirm that with the PCR, that again, then will fall into the normal routine of contacts that you contact the HR manager, or your supervisor, or you reach out to the contacts on your own. And how can the Board of Health maybe collect some information to provide guidance for people on how to go about that, and then what do you do when you test positive? So that might be something that we need to pull together relatively quickly because of, as you saw the curves, they're very steep at the moment. And,
Right.
and it doesn't look, I'd go along with Matt on, it looks like it's going to be a challenging period.
Right.
So I want to be cognizant.
Right. So I have, and I have another, and I will. Oh, go ahead. I'm sorry.
Wendy, I just want to, we have a variance hearing, so we'll need to do that and then sort of circle back. So I don't mean to quash it. It's just we have to stick to the.
Oh, that was fine. I just had.
Perfect.
So,
no,
okay,
absolutely.
so we will come back.
I understand. Thank you.
Yeah. We will come back
great.
to COVID again in between whenever we can fit it in. But
Sure.
for now, it's 7:30 p.m. We have a variance hearing for a septic replacement at 47 Old Orchard. And let's see, Ellen, do we have all of the green cards?
Yes, we do.
Okay. And is Dan here?
Dan, you here?
Oh, you know what? There are people in the waiting room. I bet he's one of them.
Dan, you can come off mute. We're excited to see you.
All right, we've been stuck in the waiting room.
Yeah,
know,
sorry. It was a
terrific.
busy discussion and we don't have anyone. It's me trying to
Oh.
keep up. So, all right. I have the plan up and that's as far as we've gotten. So you can take it away for explaining the reasons that the variances are being requested. And if then the board will ask questions, the agent may ask questions, and we'll find out if there are any people, certainly abutters, who may have questions or comments. And
All righty.
and then we'll
So
vote.
for the record, Dan McIntyre, engineer representing the homeowner. This house was recently sold. It did not pass the Title V inspection, so it had to be replaced. We went out there and did some soil testing in general, the site is characterized by shallow ledge. We did a number of test pits throughout the backyard where the existing system is located. I think we did 12 altogether. And we eventually found an area large enough with the suitable enough soils to put in a system. So we're proposing to put in an Elgin trench system, which is an alternative technology. We did design it to be Title V compliant because they are asking for a +1 in the bedrooms. It's an existing 3-bedroom house. They would like to make it a 4-bedroom house. We are putting in a tank in the backyard, a pump chamber to pump up to the leach field because we have to mound it due to groundwater and refusal. The only waivers we're asking for are 2 under the Sherburne regulations, both related to the groundwater table. The first one is that the groundwater table is less than 5 feet below grade. And the second one is we're requesting a 4-foot groundwater offset for Title V rather than the 5-foot offset required by Sherburne, just to try to keep the mounding and drainage concerns to a minimum. And with that, I can turn it over for questions.
Okay, so I see we have the well radius that pretty much knocks out this portion of the yard for consideration. And I guess there are no neighboring wells that are significant for this.
Yeah, they're pretty far away.
And I could believe there's ledge just based on the slopes that I'm seeing here.
It
So does
appeared that
anyone on
way, kind of just to the left of your cursor is kind of a boulder fill right there. It looks like they filled that area to make the lot. And then there's exposed ledge in that area as well.
Mhm.
And Dan spent quite a bit of time out there looking for the location with the least amount of ledge and the most amount of soil. So there's quite a bit of soil testing right where your pointer is right
Yeah.
now. And but we were out there for 2 days based on the needed exploration due to the ledge.
Right. I don't have any further questions because it does look like the usual challenge.
Nothing for me as well.
And Rebecca, any questions or comments?
Rebecca, I think you're muted.
No questions. Thank you.
All right. Are there any abutters in particular, but anybody else who has any comments or questions they'd like to bring up at the moment? And Mark, is there any, I guess based on your earlier comment, I'm assuming there's really not a better spot on this property for this.
Not that I can see, and from observations being out there with Dan both days, I think the location for the leaching field is probably the best it can be. The only comment I would make is where the tanks are going in. If we do discover ledge there through the process of installing the septic tank and the septic pump chamber, we'll have to be aware of the ledge disruption regulations. So hopefully it wouldn't be more than 10 cubic yards of ledge that needs to be disrupted. But if so, they're going to need to follow the process with that as well. But that we will not know until the tanks are installed.
Okay.
Dan, do you have any estimate if we may encounter more than 10 cubic yards?
I don't think so. The test pit we did down by the tank, we hit refusal at about 5 feet.
Okay.
So I think probably the bottom 1 or 2 feet of the tank will be in ledge. But we're trying to put at least one of the tanks near the existing tank, which I assume has already been blasted out for, so.
Okay, that's helpful. Thank you, Dan.
Okay. All right, so we'll move on to the variances. Do we have a motion to grant a variance to section 8.01?
So moved, or second.
Perfect.
Okay, any other comments? Daryl, I.
Rebecca Honeywell, aye.
Matt Battaglia, aye.
And do we have a motion to grant a variance to section 8.02?
So moved.
Second.
Any other comments? Daryl, I.
Rebecca Honeywell, aye.
Matt Battaglia, aye.
Okay, so I will close the hearing. And are the plans ready for approval, Mark?
Yes, they are conditional to deed recordings, both for the garbage grinder request to not have one in and to have that reduction, as well as for the innovative alternative technology that's being utilized here.
Okay, do we have a motion to approve the plan subject to receipt of the 2 deed recordings?
So moved.
And any other comments? Daryl, I.
Rebecca Honeywell, aye.
Matt Battaglia, aye.
Okay. All right,
Well,
any
thank you
other
very much.
questions from you, Dan? Thank you.
No, I'm good.
Perfect.
Okay,
We'll see you in 12 minutes.
All righty.
all right,
you,
so
everyone.
back to, all right, so we have measures.
Daryl, just so you know, the homeowner thanked the board as well. He's here, just so the board knows.
Okay,
That sounds
right,
good.
yes, and we are abbreviating things. I do want to let people know, feel free to ask questions because we just have had pretty full agendas and we're moving through things a little more quickly, including that now people can see everything more clearly on the screen so that we don't repeat as much as we used to. So don't hesitate to ask. In any case, so back to, before we move on to some of the other issues,
So
do we want to bring back the either mandate or recommendations for masking in town hall, encouragement and support of work from home, and a recommendation for no in-person public meetings?
I think that it sort of passes the gut check for me. I think for me, one of the things I've been trying to think about is like there is going to be a transition phase that we're in that we are obviously not in now, but that again, I think being really clear and specific about why we're doing what we're doing. So we pulled off the mask mandate for a reason. We're seeing really accelerating cases that leaves me concerned about the ability to maintain personnel. And so I think it makes sense to put that mandate back in place. I'd recommend that my own personal bias is I'd favor saying that we need to review it at the first meeting in February, just to make sure that we continue to make active choices about it on a regular basis, because I don't think this is a new normal. I think it's a response to the very rapid evolution we've seen. And I think it's reasonable to say that we should, as a board, revisit that in that first February meeting. I don't know that we have to make it expire or that it has to be renewed there, but I think it should be discussed at every subsequent meeting to make sure it still makes sense and for us to actively choose. And certainly within 4 weeks, I think we should actively revisit it based on the case rates we're seeing then.
I think that's
Yes.
a very good idea to have too, because we're literally seeing the data change, by the hour. I think it totally makes sense to revisit it each meeting when we're looking at the data anyway.
Yeah. And I continue to kind of send the updates to the board with the data weekly. And if the other sort of town offices or groups that are not part of that routine data release, I'm happy to add anybody who'd like to be added from a town department standpoint or a town employee standpoint. I'm happy to include folks on that distribution.
If I may, Matt, to that point, I think that would be very helpful. The education part, I believe, is needed in town hall, just so people think, it's just not a mandate to wear masks. There's good reason why the board's making these decisions. So anytime we can educate the entire staff, I think it will just make it easier for understanding why, because there are sometimes, the questions that might come up.
It changes so fast. And I think that's, what has given everybody whiplash. I think for folks who are interested in sort of finding out more and more of the source data, I think that, you know, one resource that's been really helpful, particularly for Omicron, is that on about a weekly basis, the government of the United Kingdom releases a technical briefing that is sort of, they're a couple of weeks ahead of us. And so that's where a lot of the good data about transmissibility and vaccine effectiveness has been coming from. Unfortunately, both of those are not great news stories, but it's, I think, technically well done data. And then there have been several medical grand rounds that are accessible to the public from the University of California, San Francisco hospital and their sort of medical system that have been really excellent reviews. I think the hard part for Omicron is that it's like milk in the back of the car. It doesn't stay good real long in terms of data. And so, you know, stuff from a month ago is pretty outdated at this point, but some of that should stabilize a little bit as we get more experience and more domestic experience. And so
I'd like to add a couple issues that we've talked about in the past and have chosen not to go down those paths. And that would be whether we would recommend that the town either require employees to be vaccinated or find out the vaccination status. And I just want to raise it so that we've covered the topic. And do we want to pursue those?
So I would say, I feel like that is a much weightier topic that if we want to go down that needs to be on the agenda and really clear. I think it's a really valid question to think about. And I certainly have my own responses, but I feel like it's far enough off the general COVID update that I'd like to push it to potentially the next meeting to have that discussion, just so it can be fully posted if folks didn't anticipate it being discussed tonight.
Okay. All right. That's okay with me. I can't imagine making that decision without vetting it with other groups in town, including town administration in particular and select board. And then the COVID work group.
Our own recommendation without, and then consider their concerns, of course. But we can still make a recommendation tonight.
Well, I mean, I would say what I would favor doing is to say, I think we should have a discussion. Like the reality for the vaccines is that whether we made it mandatory tonight or not, the data around 2 doses is limited. And, you know, even for people who are freshly vaccinated, the data seems to support that it's the 3rd dose that's getting better efficacy against Omicron. So even if we as a board said, boy, we think this is a really important thing, it'll be about 6 months before people have really completed the vaccine series unless they expedite the 3rd dose. So I think it's a very important topic, but I don't think it's a very urgent topic, if that makes sense. And I think having time to talk about it in a clear, transparent way is probably more important than getting it done faster in this regard. I don't feel the same way for masks. I think for masks, there's some urgency there because that decision has an effect tomorrow.
I'd also like to mention, if people have the option of using a surgical, a KN95 or an N95 mask, they are far preferable to simple cloth masks, according to the studies that have been done. So I just like, it's impossible for us to, I think, dictate on that because it somewhat depends on availability to individuals, but
I wouldn't dictate, and at least my own experience has been, I can certainly wear an N95 for 4 hours. I think as it gets longer than 4 consecutive hours, to me at least, it gets more challenging to wear that. I certainly feel comfortable doing it, seeing patients and all the rest of it. But if you have a properly fitting one, you should be pretty miserable after 8 hours with it. And if you're not, it's probably not really functioning like an N95.
and properly fitting is a very good point as well.
Yeah.
But even with a mask that doesn't fit and maybe isn't 100% effective, we have a lot of evidence that even even
Right.
ineffective cloth masks are beneficial for for the spread of disease in a greater setting.
Yep.
So, and at Newton Wells Hospital, out of the patients in hospitalized COVID-19 patients, so not people with COVID-19, those sick enough to be hospitalized, 70% are breakthrough cases who've been vaccinated. So I think there's a very good argument to continue recommending mask usage only for the potential benefit for the spread of disease.
Yeah. And so kind of, I guess, in terms of, trying to think, I just want to take a pause before the next hearing, just because I know I cut off Wendy before. Is there any other kind of town employee or department input? Because I think we won't get this wrapped up before the next hearing, but I certainly don't want to kind of knock it down.
I guess I feel that, like, as a Board of Health, we can say that we think it's important for the spread of disease without requiring and recommend it, without, and that, have a public forum. There are always going to be multiple opinions, but I think as a Board of Health.
Oh, no, Rebecca, that wasn't like my personal belief is, I think we're in a window where if we don't mask in town buildings, we're going to see outbreaks as a result. Because I think we're, again, unless, we're uniformly boosted, but again, I've got heavily vaccinated and boosted staff, and we're still getting cases, and everybody I know who's gotten it, who's been boosted, has done really well, but you're still out of work. And so, that's a piece that I think, even if I think people will likely do okay with infections if they're vaccinated and boosted, but the disruption on the personnel side is just so substantial. I think I'm certainly supportive of a mask requirement and saying we need, this is time limited and we're going to reassess it each meeting, and certainly reaffirm it by the first meeting in February.
Matt, I could say that just within our own office, you have 4 departments. 4 departments could go down all at once if we all exposed each other and got Omicron. So I would suggest that we look at the various avenues that have been mentioned that would help protect the workforce.
And I think the other thing we can do, going back to Wendy's earlier point, is to see if Alyssa can either, if there's any prepared materials we can circulate, sort of like a what to do with a positive antigen test, both within the office as well as, that we can share with community members. Because I don't think that the community contact tracing is going to be able to stand up to this case volume. Like, we have less resources than we did for a 10th the caseload. Jeff, fire away.
Well, Mary and I weren't that interested in a septic replacement, so we've been talking for the last 20 minutes while you were busy with well separation. So Mary and I think that it might be good with the Board of Health input that the select board create some kind of a memo for Diane to distribute within town hall on guidelines for town hall, including things such as masking, whether we want to allow citizens to still access town hall or not, whether encouraging people probably to work at home to the extent they can and still perform their job function. All the kind of things we did a year or 18 months ago, we may have to reinstate some of them.
That sounds right to me, Jeff.
All right, so let's come back to that because we have a hearing.
Okay.
And so we'll discuss that, and Diane and I had a chance to talk about that a little bit the other day as well. So
you do that. I have another call at 8, but I'll dial back in when I'm finished. So
okay.
Or you can text me. Ciao. Thanks,
Okay.
guys. Appreciate
All
your
right.
help.
It is 7:51. We have a variance hearing for a septic replacement and expansion at 41 Perry Street. And Ellen, do we have the green cards?
Yes, we do. It's all set.
Okay, and Dan, you still here?
Yes.
Excellent. So you may again explain the reasons for the variance request.
All righty. Again, for the record, Dan McIntyre representing the homeowner. This is 41 Perry Street. Perry Street is over to the right-hand side of the drawing. Along the bottom of the drawing is the Eversource power lines. This is one of the few properties in Sherburne that actually have town water. They don't have a well in the property. It's served through Framingham. But I will note that we did locate the proposed septic system with an eye toward the future in case a well does have to get drilled in there. We did reserve an area on the plan for a well that would meet the setback distances to the septic system. This is a 3-bedroom house served by a septic tank and leach pit. It actually passed the Title V inspection, and it was sold earlier this year. But the homeowner is doing extensive renovations before he moves his family in, and that triggered the need for a new septic system. So since he has to go through the process anyways, we're proposing to upgrade it to a 4-bedroom septic system. So we designed it per Title V, but we are asking for a couple of Sherburne waivers related to the groundwater table. So again, similar to Old Orchard, we did some test pits out here, found some shallow ledge right in the direct backyard, and then started searching around. We didn't have to go too far on this one, but we did find suitable soils over in front of the barn on the kind of the lower side of the backyard, where we found suitable soils, but the groundwater table right at 5 feet, which is kind of triggers the need for the variance under the Sherburne regulations. Because of the plumbing in the house is under the slab, we do have to have a pump system. We're pumping it up to a conventional stone and pipe leaching trenches. And I think that's it's pretty straightforward.
Is there a place on the property that could meet the Sherburne regulations since they have to go through the process anyway? Without a variance, in other words, not with, I mean, I know that you're trying to help them, and just curious if there's a way to do this without a variance. Since obviously ledge is not going to be particularly forgiving.
If I can add, Dan, just a couple points that may help with the board understanding the site. You're going to see a water line coming into the house. It goes through the driveway. I don't know. There you go. Thank you, Daryl. This is very unique. This house is on town water from the Framingham prison. Dan has reserved an area in the triangle to the bottom right of the plan for a potential well. There's an abutter to this property that already has put in a well that was attached to that water system, since they may not be guaranteed to be able to stay into that system. So that didn't help in locating other areas for testing. And I guess, Rebecca, to answer your question, it's difficult when your groundwater tends to stay within the same area. We didn't find any different soils, but I think the constraints of where to put a well leaves Dan in a spot where at least there's enough soil to design a system, but groundwater may be about within that first 5 feet throughout the entire area.
Yeah, I mean, I just think it's kind of ironic because it's good for them because it's not going to potentially endanger their drinking water, but it just contributes to, you know, the bigger Sherburne challenge of having shared aquifers and nowhere for the septic to go because we're on ledge and wetlands and all that stuff. So I'm just curious. Thanks.
Any other questions from the board or
Nothing for me.
neighbors? Okay. So let us move on to the variances requested. It's like a deja vu. All right.
Hmm.
Do we have a motion to grant a variance to section 8.01?
So moved.
Second.
And I'll just note that still the 4 feet per Title V is being provided, which is positive. And of course, this is an improvement over what is there. So, Daryl, I.
Rebecca Honeywell, aye.
Matt Vitale, aye.
And do we have a motion to grant a variance in section 8.02?
So moved.
Second.
Other comments? Daryl, I.
Rebecca Honeywell, aye.
Matt Vitale, aye.
Okay, so I'll close the hearing. And are the plans ready for approval, Mark?
Yes, they are, and that's conditional to a 1 deed recording. They're not designing for the garbage grinder, so the garbage grinder prohibition deed recording will be required.
Okay, so do we have a motion to approve the plans subject to receipt of the noted deed recordings?
So moved.
Second.
Other comments? Daryl, I.
Rebecca Honeywell, aye.
Matt Vitale, aye.
And if I can just make a note, the soil testing, the upper soil test did have ledge closer within 96 inches, but within the system area, we got good depth. The depth is giving us plenty of soil between the septic system and any ledge at the base. If there is ledge, we didn't discover ledge within the system area.
Which is great, because otherwise you really do need to add an extra foot by regulation, and certainly the more the better. So, all right, thank you.
Well, thank you very
Dan.
much.
Any questions? No? You're all set?
I'm good.
All right, thank you. Okay, so where were we on COVID? We're talking about the issue of vaccines. Oh, information to provide. So would the board like to authorize, would anyone like to volunteer or authorize me and maybe Ellen, I'll volunteer somewhat, to pull together information from what we've provided in the past to the town for guidance about this, and issue something, and then also drawing from CDC and some other sources for guidance on if people are testing positive with the home test kits, getting information about what they can do, and perhaps working with our public health nurse as well to generate that material. Because I don't think we want to do it tonight during the meeting, is I guess what I'm after.
I think we definitely don't want to do it tonight. I would say I am happy to be involved. My bandwidth, kind of related to day job in COVID, is pretty limited. So I would if you're able to be a buddy with me on it, that would be appealing. But I'm definitely happy to kind of get done what I can get done.
Okay.
Work with Ellen and with Alyssa.
Oh,
And maybe
all right.
it'd be like,
That sounds great. And then I can back up. I can look for the older materials that we had perhaps, or something else. So sure.
that sounds perfect.
All right. And would we like to vote on that? Since we'll be issuing something that the board hasn't reviewed before the next meeting. So is there a motion to authorize?
I think we should
Yeah.
authorize, well, so I guess let's authorize you, just in case if I end up not being able to do it,
Okay.
because I end up pulled into clinical, then you're the authorized party. But I can help tee stuff up in case, assuming I'm not pulled. Does that sound reasonable? There's just a possibility that, like, I'll get pulled, and if I'm clinical, I won't be able to do anything.
Yeah.
So
Okay.
why can't we get a draft. So what if we want to give some input?
Well, I think there's some parts that we want to implement immediately. And
Yes.
so we need to then, we wouldn't be able to discuss it for 2 weeks. I think we have, certainly for the mask requirement, that's something I'd like to see us implement before that
Yeah.
point.
And it'll be a lot like what we've done before. It's just maybe updating it with some minor new additions, certainly with the testing available now and people getting their own results without going for formal PCR tests. So that's the part I see as different from what we've done before. So do we have a motion to authorize me and or Matt to work with Ellen and the public health nurse to create new guidance materials for the town regarding masking, work at home, or work from home and other arrangements, and continued Zoom meetings?
I did like Jeff's suggestion in terms of, I'm happy to have the Board of Health be kind of subject matter experts, but again, would love to see the sort of select board and administrator, could that be the pathway from more of the communication? I think we can certainly help work on the content expertise, but in terms of the implementation, I like what Jeff was suggesting before he had to step off.
Mm-hmm. Oh yeah, I do view this as something we're preparing to then provide
Yep,
to
that sounds
town
perfect.
administration for outreach and for oversight and management, and relaying back to us any questions that are encountered along the way.
That sounds perfect. So
Okay.
moved.
I'll second. Any other comments? Daryl, aye.
Rebecca Honeywell, aye.
Matt Vitale, aye.
Okay. Let's see. We reviewed data. We have here COA programs and senior cafe. I will mention that got added when senior cafes were planned, but the Council on Aging did decide to hold off on the cafes for a few weeks and keep an eye on changing conditions. And Sue, did you want to say anything else about that?
Yeah, we just, we've put all our January programs in person on hold and moved to Zoom except for the senior cafe, which we are doing a drive-through lunch next week for people, just because we feel it's important that they keep connected, and as everybody else, they're, everybody's weary and just trying to keep people from not getting isolated again.
Okay, that sounds good. And I know you had another question that has to do with testing, and there, maybe I'll have Ellen describe it, but there's an opportunity for towns across the state to enter into kind of a buying arrangement through the state to get test kits. And so there's the Council on Aging has expressed some interest in getting help with finding test kits, as everybody wants test kits now. But there's also an issue of the schools needing better access to that, because that is to me, a very special circumstance where you have a lot of people congregating. It's important to keep the kids in school. It's just a much more complex system than many other places. And I could see a possibility of doing that in order to support the schools better. And so either Ellen, do you want to, is there anything much more to explain about that? And Matt, I don't know if the Health and Hygiene Committee has been looking at the school situation regarding test kits.
I would definitely say Health and Hygiene has been talking and thinking about school a lot as it relates to testing and as it relates to, again, kind of managing where we are right now and helping school remain successful and in person. I think testing is a really key part of that strategy. So anything we can do that helps facilitate access. I think the school and Dover are also pursuing lots of other strategies, but if there's any avenue to get testing, it feels pretty appealing right now. Even if it ends up kind of duplicative, I think that's a great problem to have.
Mhm. I think Ellen had mentioned that the availability of these test kits could be 6 weeks out from now, because everywhere is a bit strapped for test kits, and I'm not sure that this would bump us up ahead of CVS or Walgreens or anyone else in terms of acquiring them for timing. So it's not necessarily the be all and end all.
Daryl, just a couple, I've had like some seniors that are really compromised, and of course, we've been just trying to find tests for them. So if there was a way for us to either, I don't know, if you're a miracle worker and you can find us some tests that we could just have available for some people, that would be awesome. But I just worry about, the more of the seniors that are really need to get a test.
Well, and I think, Sue, a really key point to that, actually, Daryl, that it makes me even more enthusiastic with the 6-week lag. So the Paxlovid, which is the Pfizer offering, which has pretty good performance data in folks that are at high risk of severe COVID, needs to be given within the 5 days of the onset of symptoms. And so I think that, we won't be getting substantial amounts to market until, for February, we'll get the first aliquot, and then later in the spring. But I think especially for COA, having access to antigen testing so that if people are having symptoms, the threshold for testing is really low so that they can get Paxlovid in the window that it's got to demonstrate benefit makes a ton of sense. And so even if we get to a place where we've got pretty good community access, I do think there'll be some use cases where having on-hand supplies, whether that's school or managing a specific outbreak or, something like COA and looking at vulnerable folks getting access to, meds that are pretty promising makes a ton of sense.
Thank you.
Okay, and I did want to note, so Kitty, you had your hand up, and then Marion next.
Can you hear me?
Yes.
Okay, my thing I keep bringing up is the concern of keeping the Woodhaven Community Room open. My gut feeling seems to be that we probably should close it at least for the next 2 weeks and see how this thing continues. But it's the middle of the football season, so which is a big deal to the many of the there aren't that many. I think at the most, looking at our attendance recordings, it's about 6 people that go to watch the football games. And but am I being overreacting by saying we should close down the community room for at least the next 2 weeks?
I think so Kitty, I'd say this is Matt Natale's opinion. I don't think you're being overly cautious, just because we certainly see things where there have been a number of outbreaks that are sort of the holiday party among people who are all vaccinated and boosted, and seeing groups of 10 out of 15 people becoming infected over the course of a 3-hour dinner. Certainly there are many other times when it's fine, but I know that you guys have worked really hard to make that space accessible. My 2 cents is I would favor shutting it down for a very short period of time to say this is going to be 2 weeks and we'll actively reassess, because I totally get that people want to get back to normal, but like this is growing faster than we've seen at any other point, and it's like how do we make good choices and stay safe? So I don't think it would be a requirement for us that you would do it, but if you said what's your 2 cents based on what you're seeing, it's what I would recommend, but I probably wouldn't require it. I don't know how others feel.
I'd like to speak at some point when you're done. Go ahead.
No, go ahead, Rebecca.
I was going to say my personal opinion is that the benefit of the shared space is great. And so I would say require a mask in the common space, or else not use it. Because you
Oh.
could also leave the viral particles floating in the air for the next person to come in and breathe. if you're
Well,
allowed-
we,
if you're
it
allowed.
is, masks are required now.
Oh, okay, well, then maybe, my opinion would be, as long as you're wearing masks, I don't think that, I feel that you need to close the open space as long as you're sharing, I mean, the shared space as long as you're protected with a mask, but that's my personal opinion.
Okay. You're not making it very easy for me.
So I guess I'm swayed by the fact that hospitals around the country, for staffs where the masking protocols have worked so well before, but Omicron seems different, and they're not working in the same way as it worked before. So I would probably err on the be more cautious for some period of time, even with masks.
Well,
And or get much better masks for people.
Okay. Well, once again, I am very grateful for your input. It's very helpful, and the residents down there have tried to be super cautious and respecting each other. And I don't want to see them get sick now. We've come this
Right.
far. We want to keep them healthy. I appreciate your input. I personally feel I'm going to recommend we close it down for 2 weeks. And then maybe by the Super Bowl, they can be in the room again.
If the Pats are in the Super Bowl, there's no way I'm going to take responsibility for closing. My house will burn down. It'll be no good. I can't have that.
Well, thank
Also,
you.
there are now more comfortable N95 masks that are shaped like the KN95. They're foldable, so
Mhm.
they're just more comfortable and they're good protection. And I picked up a box at Home Depot, so that could also be something to look to. Looking ahead is getting better masks for people.
Right. Very definitely. Well, once again, I thank you so much.
Thanks, Kitty. Have a good night. And then
Okay, and Marion.
I have just a quick comment. It's sort of backing up to a previous subject that I didn't get the comment in then, but I do want to now. As you put out your new guidance that Daryl, you're going to put together, Matt will vet. I would just ask that when you use the term test or testing, when testing is required or when you should get tested, specify the test.
Yeah.
This hasn't been done well by the CDC or anybody else, except for maybe Michael Mina. The PCR tests and the antigen tests are really very really very different. They have different uses, and people need to know which one you're talking about every
That's a
time you
great
say
point.
test. That's just my comment.
I think
So
that's a
I
fantastic-
hear you volunteering to review it to make sure we have all the test specifications correct. Did I get
Well,
that right, Marion?
I think Marion's really just saying it's less like which of the antigen tests, but if you mean antigen, say antigen. And for example, as we look at a lot of the people coming off quarantine at 5 days, for example, you would want to use an antigen test for that. A PCR would be inappropriate. Is that what you're thinking, Marion?
Exactly. That's exactly what I'm thinking.
Right, and I'm thinking that I'm going to ask Marion for help. That's what I was
Perfect.
getting at.
Well, as long as Matt checks it out for me.
Perfect.
And also, the antigen test, two antigen tests done on sequential days is much better than one, that sort of thing. People need to know.
Yeah.
I think that sounds perfect. Will
Okay.
do.
Yeah, I'm happy to help, whatever.
Okay.
Daryl, this is Wendy again, and I'm gonna just,
Yeah.
if it's okay, I have
Yes.
one quick clarification. 5-day isolation. If it's still symptoms,
Oh,
continue.
Wendy, you're breaking up again.
I
You were
guess
very
that might be
clear
a,
and-
So Wendy,
Okay, can you,
I think I got the gist. Can I take a stab and then you can just do like a thumbs up?
yes,
I think your question is, if people are at 5 days but still have symptoms, they should not return. And that is absolutely correct. And upon returning, anybody who comes back having had COVID should remain masked at all times, whether they're in an office alone or whatever, for the additional 5 days. This is not the CDC saying it only lasts 5 days. It's a CDC saying we're trying to thread the needle and give guidance that people will comply with while minimizing the risk that our advice will cause harm. I think that also if we get to a place where we have access to town-based antigen testing, then there also could be an appropriate role for that as part of a return to work. I think it's hard to require now when it's not readily available, but I think that it's what's in place in my workplace, and I would certainly be comfortable saying that's what we'd recommend for the town. Was that close, Wendy?
perfect, thank you.
Okay, now I have a question. I will be on a webinar tomorrow afternoon about purchasing these at-home tests. Should I can move forward with that, or is?
Right, I think a
And then I
question
need
could
to
be,
know the number, how many, which type, all of that information.
Ellen, what time is the webinar tomorrow?
It's at 1 o'clock.
Oh, shoot, I have a conflict. Maybe can you and I connect tomorrow morning and
What
we can
is
kind of
the,
go through
what is the conference?
It's a webinar just with more details about how to go about purchasing the at-home tests.
Ellen, I'd be happy to connect with you tomorrow morning and maybe we can think through some of that together. Would that work okay for you?
That's perfect.
Perfect. That sounds good. I'll text you to arrange a time.
Yep, okay, thanks.
And again, I see a lot of familiar names from town, and I'm sorry it's been so fragmented. I just want to make sure that anybody else who's kind of a town employee or department head or anybody else, if you have concerns or other things you feel like we're not thinking about, please feel free to chime in. We want to hear from you.
okay, well, maybe we'll move on, but if people think of something and want to raise their hand at some point, that would be fine. Okay, Groundwater Protection Committee educational webinar is coming up on January 25th, 7 to 9. I'll ask Tom Trainer just to speak briefly on that in a moment. If Tom, you're still on, I hope.
I am. Thank you very much.
And I'll just mention one thing is I tried to register and something wasn't working. It wasn't letting me actually register.
We've had a couple of reports of that.
Okay.
And the most common issue, and it's not clear, I've asked them to put a statement on their form. You have to put in something in the box that says, do you have any questions?
Oh, I did.
And you still had trouble. Well, let's talk
Yeah.
offline. But
Yeah, okay. I just
other
wanted to let you
people-
know about that in case registration is critical.
yeah, we're up to about 40 names, so it is working, and
Okay,
I apologize for that. Anybody who's having trouble, please try to reach
okay.
me or anybody on the groundwater committee. But we're excited to offer this. We get a lot of questions, as I know your board does, about the private wells in town. And it's just going to be a introductory talk on well construction, well maintenance, what things you should be concerned about, activities on your property, and of course a little bit about testing and potential remediation if anything comes up on the testing. So we say 7 to 9. I've talked to the speaker. He's probably got a 45-minute slide whipping, but he encourages questions during the presentation and of course after. So we're going to try to keep it a dialogue. So we hope people are interested and learn more about the investment they have in the ground in their front yard.
Okay, does anyone have any questions for Tom?
And actually, I forgot to add, Daryl, thank you and Mark for offering to join us and be available for any perhaps Sherborne specific questions.
I would
appreciate
also
it.
like to join. What's the best way for me to communicate with you to get on your list?
I will email you, Rebecca.
That would be great. Thank you.
And I'm gonna, as I mentioned, I think that Daryl and Mark, the moderator is gonna know that we're forming a little panel of Mark, Daryl, myself, and we'll add you, Rebecca.
Yeah, and I still plan on attending. Thank you, Tom.
Thank you. That's all.
Thank you.
Great. Thanks.
All right, I'll do a couple of easy ones. The discussion of the public health nurse. We're getting some information from a neighboring town that has not come through yet. So I'm going to save that again, because I think it'll be better with more information. And Matt.
I'm wildly delinquent, but I'm blaming COVID for this and basically everything else.
Okay, good. All right. So see, we're moving right through. So that was for item 4 here under Chair's business. There's another project coming up. Let me just bring that up. Okay. So Central Massachusetts Mosquito Control Program is going to be doing a presentation on February 15th. I have been meaning to ask when. I am guessing it's in the evening, and there should be more information coming out on that, but just for people who are interested to let you know that's coming, and keep an eye on the town calendar as well. Let's see. So Mark, there are some items here: 59 North Main, 34 South Main. Are there people here waiting to discuss those?
For 59 North Main, I left a note within the building application process that it would need further discussion. I don't know if anyone is here to discuss it, but I can present to the board what has been presented. Same for 34 South Main Street. The builder was notified for 34 South Main Street that it would be discussed. I don't know if anyone's here for either project. I don't
Okay,
see anyone saying
yeah, I
anything.
don't see hands or anyone speaking up. So which one would you like to discuss, and which documents would be useful
Sure.
for me to show in which order?
I would say whatever's first. I think 34 South Main might be the first one in order of the agenda documents.
Okay. And is the application, the house plans, the plot plan, which of the things would be good for looking at?
Yes, so that's a house that actually had a septic system put in with a deed restricted bedroom count based on the opportunity to put a system in. They didn't have much land, and it's a 2-bedroom deed recorded, deed restricted septic system. So the plan, thank you, Daryl, there it is right there. It's out in the front. They have very tight area there. And I believe that was 15 years ago they put that in. They wish to take, the house right now is a 4-bedroom, four rooms or 5, it's how you look at the first floor. And they wish to put in they're saying a gym in the back with a half bath. And they haven't yet submitted any plumbing plans to show how they're going to plumb it and how they're going to dispose of the sewage. But at this point, I think they're curious if they can even do it. So.
And when you say in the back, do you mean in the shed?
Yeah, you're right at the right place in the shed area.
Okay.
They wish to turn
Okay.
it into a gym is what, a workout room is what they're calling it.
Mhm.
So there's the house plans, and they have never responded. I did ask if they had any attic or basement rooms, and they did not respond that they did, but I do remember inspecting the house many years ago after the system was put in. I think it was just a typical basement. But up on the first floor, it's all in how you look at it, but it shows the kitchen and the living area and a little dining area in between.
Mhm.
And then on the second floor, your 2 bedrooms. And that's pretty much all that
Hmm.
they have there. It's a very limited house. They
Right,
wish,
are you regarding this as, this is
I
an
counted
evening
it as
kitchen?
one, and that's why I
Yeah.
said you might see it as 2. It's all in how the board wants to see it. I see it at least as a minimum of a kitchen and a family room, with the kitchen having an eat-in area.
Yeah,
And then the second floor with the 2 bedrooms. And then,
okay.
so there's the 4
And then the
rooms
basement.
and a basement, unfinished basement. They would have to label that. I did ask that they do that. And then the outside area, you can see to the far bottom right, they have it in yellow. They're proposing a workout room, a workout space is what they're calling it, with a half bath. Thank you, Ellen, for making sure you could read that. So Ellen did print down the bottom. I believe that's Ellen's print. She's got very neat print, so I believe it's hers. That it is proposed that way. They have not yet submitted any plans to show where the sewage going. They might have to put it into a pipe to the house, or they might have to put it into a septic tank to the leaching field, but if allowed. But this would be the 5th room, and it's already deed recorded to be a 2 bedroom. So it's one of those things, if we want to divide by, if they have no other rooms, it might be okay if you look at an odd number rounding down to the even number. You have 2 bedrooms divided into 2, but because it's deed restricted, I wanted to make sure it was presented to the board before any decisions made.
I'd also say it depends on what's going on with the basement. Is there any
Yeah.
finishing
Yeah,
planned? So that, because that could make it 6 rooms.
correct. And then I would see that as a real touchy situation, because you divide 6 by 2, you might be into a 3 bedroom if you look at it that way
Right,
in general. Yeah,
without further deed restricting something.
correct. Yeah.
So we don't know, I guess we don't have details, yes, on that?
No, and I
yet on
did
this?
ask the builder to advise the homeowners to get us additional information, and I have not seen anything since, but
Mhm.
it's one of those things that, I was hoping, I did explain it would be presented at tonight's meeting, but
Mhm.
now, maybe I can get a general understanding of what the board wishes to do and invite them back to the meeting to see where they're going with any additional rooms within the house, plus the room they're planning. And obviously with a half bath, they would have to be aware that that could never be a full bath, because that would be considered almost like an in-law apartment.
Right, and also this space here, is sort of ripe for a shower, which I think would be
Yes.
nice next to a workout room. So it would be something that would have to be clearly stated.
Yeah, I agree. And that's why I wanted the board to see it and
Yeah.
see how you saw it too. But I saw all that space in the bathroom area too, thinking,
Mm.
it has to be very clear that that can only be a half bath, and that's quite a large room for a half bathroom.
Yeah. Do any other board members have comments on this? I think, getting some more specifics would help, and letting them know what the implications are is really all I have to add.
I would echo that. And again, I feel like my sample size of the sort of deed recorded to bedroom count of the sub 3 bedroom houses feels pretty limited. And so I guess it's really, have we had other instances where a deed recorded house was able to add net rooms and be compliant with the deed recording? You know what I mean? Like,
Yeah, not that I'm aware of. We have maybe 3 that I know of. This one at the corner of Greenwood and Maple, and one down off of Lake Street, off of North Main and Lake. And those are the only 3 I know of that were limited based on the size of the system they could put in.
And I'm open to being consistent with our general approach for room count. Like, I don't mean to suggest that I'm not open to going 4 to 5. I would just want to make sure that we're sort of consistent because, again, I feel like we're in such a specific situation when we do deed record to 2 bedrooms about sort of where that, of how the house ended up there. And I think to Daryl's
Yeah.
point, like
Yeah, I agree.
that, the sort of half bath really can't get to 0.51 bath. Like it's really got to be
Yeah.
a half bath, or for me, it would be a no-go.
Yeah, I agree. Well, what I could do is refer this information back to the builder and have him relay it to the homeowner so that we
Mhm.
could maybe get them at a meeting to discuss their future ideas for this property.
Sounds good.
Okay.
Okay.
Out of fairness, since they're not here. And so I'll do that then. If I have to, I'll send a letter to them because they had no contact information for reaching out to the homeowner. So I left a message with the builder down. He's from Millis, and I left him a message, but it was the holidays, before the holidays, so they may have forgotten. And the other one is 59 North Main, -9, Unit 9. Chris Canny, our building commissioner, did have some input because I sent an email out stating that, they're looking at a basement with 2 additional rooms. He did say, well, Mark, they're deed recorded for 2 bedrooms, all these units, and that's understandable. But I know we've looked at other complexes like this and wanted to make sure, it doesn't go astray. I don't know if that's the correct word, but that, the room count stays within a reasonable limit. On this one here, the issue here is that I think well, the upstairs has a loft, and if you look upstairs, it's a loft and a bedroom. There it is. Thank you, Darryl. I'm jumping ahead of myself, but it is considered only 1 bedroom up there because they open the stairwell up into the loft area. So I only counted that as 1 room on the 2nd floor. The 1st floor that's the plan I made you jump. I'm sorry, Darryl. 1st floor has the other bedroom, the master bedroom, and that's, yep, exactly right up there. And then it has the family room and the kitchen. And again, a kneading area, so and then the garage is to the bottom right. And so, and then the basement, so that there's 5 rooms, the way I see it, minimum, maybe 6, on how you want to count the loft and how you want to count the dining area. But if I'm looking at it, minimizing it, I would say you have a 2-bedroom, 4-room facility. But now what they wish to do, and they haven't labeled them, and I've asked several times that they label these rooms in the basement, which is the most lowest plan. If you go down just a little further, Darryl, I don't know if this is it or it's in red, I believe. Is there one more? It's the foundation. There's one in red, I think. Maybe one more. No.
There was another.
Oh, okay, yeah. And I think it's at the base of this. Maybe not. Maybe it's not in red. I've been looking at so many. There it is.
Here we go.
I saw some red somewhere. So you see, I see too many of these lately. But so they're looking to put in 2 rooms in the basement. So that would jump that up to 6 rooms minimum, maybe 6 or 7. And they want to put in a half bath, and they're not showing where. And I've asked for all this. Again, another one where I need to get back to them and say, you really need to get on an agenda to discuss your views on this. And I don't know what they're planning to do with the 2 separate rooms. And I did ask that they label them.
Yeah.
And again,
Mark,
Mark,
I would just say my level of discomfort feels like it matches yours, which is, you sort of look at this floor plan in the last house and you're like, there's a whole lot more going on here.
Yeah.
Right.
Yes.
And so it's just like, is this really, I get that you said it's a 2-bedroom system, but at a certain point, you could end up in like the only 3,000 square foot 2-bedroom house in town.
Yeah. Yeah. And it opens a door, I don't want to start a precedent and open a door for someone else to say, well, you allow it over there, why not in my house, so it's a delicate situation, as we know, because we deal the whole board deals with these room count issues. So I can invite them to the meeting and ask that they come prepared with the labeled rooms. They haven't yet submitted the pump information on how the half bath plumbing is going to work to make sure it's not pumping too much force into the septic. I believe that shouldn't be an issue if they can fine tune that, but they haven't even shown where they're planning to put the half bath, you know, so it's again.
Mhm.
That sounds great, Mark. And I guess my other question, I don't know if this is for Daryl, Mark, or Eleanor, but it's sort of in the setting of being because this is in a 40B, correct?
Yeah, I don't know if this is one of the 40Bs. It may not be. There's 2 units up there that are 40Bs, but I don't know if this is the one that is one of the 40Bs.
Well, I mean, it's a 40B development, but
Oh, that's correct. That's correct. Yep.
And so I guess for the 40Bs, I can't remember for the room count, you know, I think that still follows all of our regulations. That's not something that has to go back to ZBA. And the floor plan that they're proposing here doesn't sound like it's consistent with any of the other units on that property. Is that right, Mark?
That's correct. They have, and we've seen it over on the other project, slipped my mind right now, the one off of
Whitney
Washington.
Farm.
Which one?
Whitney?
The one off Washington, actually. Whitney, we see them now and then too, where they'll put a large room in. But this is the first one I've seen with 2 rooms. And that's where it triggered.
You're thinking the Fields, Mark?
Yes, thank you. The Fields, they have put in rooms in the basement as well, but just one large finished room with a half bath here and there. But this is the first time I've seen 2 rooms. So that's why I brought it to the board's attention. Because if it was just one large room finished, we've seen that before, and that would bring it to 5. But this brings it to 6 possibly. And that's why I brought this to your attention.
Perfect. I think what you proposed sounds good to me. I don't know how others feel.
No, I agree.
I also agree.
Okay, then I'll get back with both applicants. I do it through the electronic building applications and try to let Chris know if he has any contacts for the homeowners to also get to me with that, so I can keep both the homeowner and the builder involved with the decision to have them come back to the board with better plans that fully address the function of each room and the location of the half baths and so forth.
That sounds great.
Okay,
All right.
thank you both. Thank you all. I mean, thank you.
Okay, all right, so now we can tackle some permits. So we'll do this number 2 up here. It's a disposal works installer permit for 2022 for big excavation of Walpole. And are they new to us? I don't remember this name before.
Then they're not, they just put a system in down at 40 Woodland, and they have
okay.
not finished it. So to finish it, which is the final grading and so forth, they'll need to reapply, but they have been back and forth to town. They're from south of us, but we do see them now and then.
It is a renewal permit there.
Oh, okay, okay, great. So do we have a motion to approve this permit subject to pre-construction, even though they're middle of a job?
I would suggest that there only because they may find another job in town sometime. They don't do much in town, but yes, I would make that as the, motion would be accurate.
Okay.
You want to do the other disposal works installer permit renewals that are listed?
Okay, so they're all similar in that regard.
Yeah, they're all renewals.
They're all renewals. Okay, so do we have a motion to renew the permits for Big and Rodenheiser and Irving and Parmenter, subject to pre-construction conferences?
Second.
Okay, so I'll move it and it's been seconded. And any other comments? Daryl, aye.
Rebecca, Honeywell, aye.
Navatelli, aye.
Okay, and then we have food establishment permit renewals. I'll do them separately since one has a sodium posting that's going to be required. So there's the Unitarian Church. And it needs a, so do we have a motion to approve the permit subject to posting of sodium?
So moved.
Second.
Comments? Daryl, aye.
Rebecca, Honeywell, aye.
Matt Vitale, now unmuted, aye.
Okay. And then do we have a motion to renew the permit for Pine Hill Elementary School?
So moved.
Second.
Any other comments? Daryl, aye.
Rebecca Honeywell, aye.
Matt Vitale, aye.
All right, and then we have the budget. There's a meeting with advisory on the 12th. If anyone else is interested in attending, do let us know, because we would potentially need to post that meeting. Otherwise, I'm planning to go. Ellen, I hope you're able to also go.
Yes, I can go.
So, all right. If anyone else becomes a strong desire, just let us know. Let's see, I think we're up to minutes for approval. So we have the minutes from 12:15. I provided a really minor edit. Is everyone else?
I just wanted a different font. I want Helvetica. That's all I'm going for. No,
Okay.
I just had I had some minor edits, no substantive changes.
I had a bunch of edits that I sent, but unfortunately our internet crashed with the storm. We totally lost at my office, and so I literally sent it like 15 minutes before the meeting. I hope you received it.
And Rebecca, that's sort of the typical relatively kind of grammar, phrasing, no substantive edits?
There's one sentence that I think the minutes might have misinterpreted something that I said. And so but I don't think it's substantively different. But it's it's what I said in the meeting. So.
Perfect. So I think then we can just vote on it as sort of, do we have a motion to approve the minutes as amended?
So moved.
Second.
Daryl, aye.
Rebecca Honeywell, aye.
Matt Vitale, aye.
All right, and then agenda items. Certainly COVID, revisiting
I think we
things.
should,
What else? We added something else earlier.
You might, if I could, you might have 3 building applications. You might have 74 Washington,
Yes.
59-9 North Main, and 34 South Main. They probably all will be tentative at this point, but most likely on the next agenda.
Okay. And then maybe we'll have under chair's business, we might have 3 and 4 back on, if we can get information lined up for that.
yep.
Okay, and we'll see what, hopefully there's not too much excitement in the coming weeks other than good excitement.
From your lips to God's ears. I'll take it.
Okay, any other questions from any of our guests? All right, so do we have a motion to adjourn the meeting?
So moved.
Second.
Daryl, aye.
Rebecca Honeywell, aye.
Matt Vitale, aye. Have a great night, guys.
Okay,
Good night, everyone.
good night, everyone.